and welcome to our special show. I am Priyanshi Sharma. Life is valuable and precious. Being able to revive a person's heart to save their life will provide one with immense satisfaction. It's a sad but a true fact that the number of people dying from cardiovascular diseases is steadily increasing in India. Most of these cardiac deaths are sudden and on the spot. It is possible to prevent these sudden cardiac arrests if they receive immediate medical attention and CPR. Now, the recent incidences of some celebrities collapsing suddenly and passing away due to a heart attack are concerning and shocking. There is an alarming rise in the number of young patients with heart attacks and sudden cardiac arrest. What is equally scary is that sudden cardiac death may happen in people who have no known history of heart disease. The risk is higher for patients with existing heart diseases. In almost every family, we have at least one family member with a heart disease. Now, can one make himself or herself capable enough to save a life in an emergency situation? The answer is yes. It is possible if you are well trained in CPR. Many adults in cardiac arrest can be revived with intact neurologic function if the bystanders provide immediate CPR. Now, raising public awareness and understanding of the practical implications of CPR is an essential strategy to increase the success rate of CPR in cardiac arrest cases. Save a Life is an initiative through which people will be made aware of early signs and symptoms of cardiac arrest, train them on CPR, and highlight the role of CPR in saving a life. Today, we have with us eminent cardiologists who can help you understand sudden cardiac death and the role of CPR to revive and save a life. Let me take a moment to welcome our guest now, Dr. Shamshad Alam, who is a consultant at and interventional cardiology at Jayaprabha Medanta Super Speciality Hospital in Patna. We also have Dr. Varun Kumar, who is a consultant cardiologist at Healthcare Clinic in Ranchi. We also have Dr. Mahesh Uttam Rao Aher, who is a consultant cardiologist at Hrudayam Heart Care in Nashik. Thank you very much, doctors, for joining us on this discussion. My first question to you, Dr. Alam. Many of the conditions and behaviors can put people at risk for a heart disease at a younger age. Now, what are those risk factors that people should keep a check on?
Yeah, good morning to everyone. Today we will be discussing about the cardiac risk, especially as we have witnessed cardiac death in especially younger population. So let's come to the point. The cardiac risk, they are slightly different when it comes to a younger population. The most important risk factor is the family risk. If there is any history of early cardiac death in the family, then obviously a person is at a cardiac risk at a younger age. Second thing, the lifestyle changes, which we are having. There is a lack of exercise, sedentary lifestyle. The food habits have changed. The fast food habits are growing. They also increase the risk. Apart from this, excessive smoking, alcohol intake, tobacco chewing, it also adds on the risk. And the most important thing which we are seeing nowadays, that the incidence of diabetes, hypertension, they are increasing in the younger generation as compared to what we were watching it almost 15 to 20 years back. And finally, when it comes to Indian subcontinent, the issue of any cardiac event, it is almost 10 to 15 years earlier as compared to our Western counterparts. And finally, what we see due to peer pressure and other work pressure, stress, the increased level of stress, it also contributes of increasing the risk of any cardiac events.
Right. And Dr. Kumar, my next question to you. Does cholesterol accumulate right from an early age, or do people have to worry about it only after they're above 30 years of age?
Yeah, good afternoon to all the viewers. Today we are discussing a very serious topic about the cardiac health, and dyslipidemia or high cholesterol levels are definitely a major risk factor for any cardiac disease. Definitely on to your question, mostly we see that the high cholesterol levels seen after mostly 40 years of age, but there are certain conditions where we can have high cholesterol levels very early in the age. Like familial dyslipidemias, where there is a genetic defect in the metabolism of the cholesterol levels. and result in very high cholesterol levels very early in the disease. Certain thyroid conditions, and also if the patient has early diabetes, they also have high cholesterol levels. Patients who are obese, who have unhealthy lifestyle, and having more of junk foods, and those who are sedentary, and those have addiction like smoking, alcohol, can have these high cholesterol levels very early in their life. Preventive measures which can be help these patients or people to lower their cholesterol levels include that adoption of a healthy lifestyle, lowering their body weight or maintaining a healthy diet, doing regular exercises, reducing any stress, mental stress via either meditation or pranayama, and avoiding any sort of addiction. So these will the conditions will help in maintain their cholesterol levels in check.
Right. So that's, of course, very important advice considering the number of cases that we are seeing in younger people these days. Now, Dr. Ahir, my next question to you. If a person's body weight is in control, does it mean that a person's blood lipid levels would be normal too, and he or she cannot get a heart disease?
Good afternoon, everyone. Any person with any body type can have high cholesterol. So, when overweight people are more likely to have high cholesterol level, but thin people can also suffer from this condition. People who don't easily gain weight are often less aware of how much trans fat and saturated fat they eat. So, you should have your regular cholesterol checkup regardless of your body weight, physical activity and diet.
Right. And Dr. Alam, are both heart failure and heart attack the same thing? That definitely is a confusion for many people. And if they're not the same, which is a more serious condition?
Yeah, when it comes to a common man, it is a confusing thing that whether heart attack or heart failure are two similar things. If often people consider as heart block as a heart attack. So things have to make clear. Heart failure is basically inability of the heart to pump the blood out of it to the whole body. It can be a systolic heart failure due to the pumping failure, or it can be a diastolic heart failure. Diastolic heart failure is basically heart with normal function, but in spite of that, that storing capacity function has been gone bad. That's why it leads to diastolic heart failure. Heart failure, it can be due to heart attack. Heart attack is basically a medical terms, we can call it as a myocardial infarction. It is basically due to blockage in the coronary artery. Coronary artery, heart has its own blood supply. So whenever there is an issue in its blood supply, that leads to heart attack. So heart attack at times it leads to decrease in cardiac function, and finally it culminates into heart failure. And when it comes to which is more serious, so in my viewpoint, when it comes to long-term prognosis, heart failure has a more serious consequences on the risk of life as compared to heart attack.
Right, that distinction between the two is important to understand. Now, Dr. Kumar, many people die due to a cardiac arrest during sleep without major symptoms. So, do people ignore mild symptoms, or do they not get any warning at all?
Yeah, we see many patients who suddenly have a cardiac arrest during sleep. And most of these patients may be asymptomatic, but most of them have underlying structural heart disease. There are certain genetic arrhythmias which may precipitate during sleep. Sleep apnea, particularly seen in obese persons, can precipitate arrhythmias during sleep. Apart from that, there are some certain warning symptoms which may be present, which is mostly get ignored by the patient. These warning symptoms like there may be exertional heaviness in chest or breathlessness, that is when a person walks uphill or climbs the stairs, he may feel breathless or feel heaviness in chest. May have sudden palpitations, transient blackouts or dizziness, unexplained fatigueness or excessive fatigueness, even fullness of chest after having a meal, or even nausea and vomiting can have the warning symptoms for these index event. Mostly we also see that certain hormones in the body get increased during sleep quite early in the morning. Also, the blood pressure also increases early in the morning. So this is one of the reasons why we see most of many patients of heart attack, brain strokes, or sudden cardiac deaths occurring early in the morning because of this sudden surge in the hormone levels and the blood pressure. So if a patient who have certain symptoms, warning symptoms what I described, then they must get evaluated themselves by a qualified cardiologist, and if they have any underlying problem, then they must be treated accordingly. Preventive measures must be taken to all patients if they have such symptoms, and they do their work regularly and try to not to neglect any of symptoms which may culminate in a sudden such event.
And from symptoms, let's now discuss causes. Dr. Mahesh, what other causes could lead to a sudden heart attack in a healthy individual with no associated risk factors?
Usually coronary artery disease causes the most common heart attacks. With coronary artery disease means there is a blockage in the arteries, and the sudden stoppage of the blood supply to the heart muscles. So it's the most common cause. It's mostly due to the development of the atherosclerosis. Bad cholesterol gets deposited in the arteries, and there is a deposition, and sometimes there is a post-viral, there is a myocarditis causing a clot in the arteries. It can lead to the heart attack. Another main reason is coronary artery spasm. That is a sudden spasm in the coronary arteries. It can lead to the heart attack. As well as there is another term, that is a spontaneous coronary artery dissection. Coronary artery dissection occurs in the healthy individuals and the young females. It leads to sudden stoppage of the blood supply in the arteries and leading to the heart disease, heart attack. And some in the post-viral infection in the COVID era, where patients heart attack because of sudden blood clotting in the coronary arteries. And similarly, other viral diseases can lead to the myocardial damage and a sudden heart attack.
Right, and with that we'll pause for a very short break on the show for now, but we'll continue with this very important discussion on the other side. Stay tuned. Welcome back to our special discussion focusing on cardiac arrest and ways of revival. We are joined by eminent cardiologists on this show. And Dr. Alam, if I can take this question to you. As most people still don't know the difference between a heart attack and a sudden cardiac arrest, many people may mistake recognizing the symptoms. So how do you know whether it's a whether it's a primary cardiac arrest?
When it comes to differentiating between heart attack and a primary cardiac arrest, obviously primary cardiac arrest is a life-threatening situation. It is just a matter of seconds. If it is not taken care of, then it might lead to death of the patient. Whenever a patient has a primary cardiac arrest, he becomes unresponsive, unconscious, pulseless, especially. If anyone gets a patient with these, suddenly he should start on with CPR. Whatever CPR that person has been trained, and call for the ambulance immediately. Cardiac arrest, it can be a manifestation of heart attack too. At times, few cases of heart attack, they present with cardiac arrest. In that case also, the need of CPR, urgent CPR is mandatory so that we can save the life of the patient. And we have to shift the patient to the nearest available emergency medical care so that if there is a need of AED and if it is required, then obviously it will benefit the patient.
And Dr. Kumar, how many different types of CPR are there? Which CPR can be performed by an untrained person, and what are the steps to follow?
Yeah, that's a very important question. While doing the CPR, which is cardiopulmonary resuscitation, which is performed by a person on the person who have a cardiac arrest. That is, his heart is stopped beating and not breathing, and it's a very life-saving procedure, and it can be performed by a bystander who is trained in doing CPR, or by untrained person even. A trained person can do CPR when he sees the patient that he is collapsing. He checks his pulses and look for whether he is responding or not. If he is not responding for 10 seconds, he start immediately the CPR. He put the person on a firm surface and by putting both the heel of both the hands, one of the other, and start in the center of the chest of the patient, and start compressing the chest at a rate of 100 to 120 beats compression per minute, so that the chest depresses by about 2 inches. But this depression should not be more than 2.4 inches. After every 30 beats, 30 compression, he must give 2 mouth-to-mouth breath to the patient by a technique called head tilt and chin lift, so that the airways get opened. Before blowing into the mouth of the patient, he must look for any foreign body in the mouth, that must be removed. If a person is not trained in CPR, he just can do only the chest compression without giving a mouth-to-mouth breath. This CPR must be continued till the patient starts responding or emergency services come for the rescue of the patient. Now, in children, the CPR should be performed with one hand, so that in the same way as in the adult, that is a rate of 100 to 120 compression per minute and 2 breaths after every 30 compressions. But if you are unable to compress the chest by more than 2 inches, then you can use your both hands. But in infants, that is children below 1 year of age, CPR is performed by 2 fingers, by the middle and the index finger of your right hand, putting the center of the chest and compressing the chest by about 1.5 inches. Or you can also use your both the thumbs in the center of chest and compress with both of your thumbs. So CPR is a life-saving procedure, and every 9 out of 10 cardiac arrest occurs outside the hospital, and 7 out of 10 cardiac arrests occur at the home. So it is very important for everybody to know about the steps of CPR, because those patients who are receiving CPR has a survival rate of around more than 2 to 3 times than those who are not received the CPR. So it's very important that every person must have a knowledge of how to perform CPR.
Right, so it's very important to know how to perform a CPR to save a life, as you've mentioned. And Dr. Mahesh, my next question to you: how does an automatic external defibrillator help a person who is undergoing a cardiac arrest?
The automatic external defibrillator is a very important component of the CPR in hospital or in the cardiac ambulances. So it's a nearly foolproof, and it delivers shock to the patient. Computerized defibrillator that analyzes the heart rhythm, and experienced patients, trained patient or persons, it delivers the patients. When appropriate, it delivers the shock, and when patients with the ventricular arrhythmias, in the arrhythmia patients, so it shocks the heart and nearly stops the heart for a few seconds and restores its normal rhythms. The AEDs are used in the early defibrillation in out-of-hospital settings as well. In out-of-hospital settings, there is a procedure called cardiac thumb. It can be used in the during a CPR.
Right, and Dr. Alam, diet also plays a very important role in recovering after a cardiac procedure. So what diet should a person follow after angioplasty or also after stenting?
So the diet modification is very important whenever a patient undergoes angioplasty or a cardiac surgery, or a patient has recovered from a cardiac arrest or even myocardial infarction, heart attack. We have to classify diet into 2 kinds: short-term dietary controls and long-term dietary controls. Long-term dietary controls, obviously, they will have some mortality benefit. So when it comes to long-term dietary controls, the most important thing, we have to remove trans fats from the diet. We should avoid fried food items, especially from the diet. The fat, even saturated and monounsaturated fat contents, they should not be very high. Amount of protein content in the diet, that should be adequate. We should be more relied upon the consumption of fresh foods and fresh vegetables, and the When it comes to short-term diet control, whenever a patient undergoes cardiac surgery or angioplasty, the diet should be soft in the first 24 hours, so that the work which is done during chewing, it should not be that much, so that there is increase in cardiac workload. And whenever 24 hours passes, how is the recovery of the patient? If the patient is recovering well, he has started doing mobilization, then obviously his diet can be changed to a normal diet, what he is usually taking. And also the most important point when it comes to the diet prescription, what we see that we cannot go through a diet plan, exact diet chart for any persons, because as we know that in India we have different kinds of diets for different kinds of regions, different kinds of religions, even different kinds of persons. So the diet should be modified as per the available fruits, vegetables, as per the available dietary plans, as per the available economic conditions too. It is not possible that we can prescribe a poor person who is not able to afford his diet, a Western diet. So that has to be taken into account.
Right, and Dr. Kumar, it is said that monounsaturated fats such as olive oil can actually be good for your heart. Is it actually correct? And what type of oil is most beneficial for use by people with existing heart diseases?
It's a very frequent question. So we are asked by the patient that what oil we should use to keep our heart healthy. Definitely olive oil, one of the very good oils which can be used because they contain more of the monounsaturated fatty acids. Unsaturated fatty acids are considered good for health, whether it is monounsaturated or polyunsaturated fatty acids. These unsaturated fatty acids, high levels of this found in definitely olive oil. Apart from that, sunflower oil, mustard oil, safflower oil, peanut oil, rice bran oil, and soybean oils. So any of these oils can be used by the patient to keep their heart healthy. Saturated fats, which is mostly found in the palm oils, vanaspati, ghee, margarine, butter, and any oil of animal origin, they are actually considered bad for health because they cause the deposition of cholesterol in your blood vessels. So they are better to be avoided. A third type of fatty acid, which is called trans fatty acid, which is considered worst type of fatty acid for the body, which is usually found in the junk foods or fast foods, packaged foods, burnt oils. These must be totally avoided. So a person can use any type of oil which is of plant origin, but contains more of monounsaturated or polyunsaturated fatty acids. So what I told that those type of oils can be used.
Right. Well, gentlemen, thanks very much for joining us. We hope that this discussion helped our viewers learn more about cardiac arrest, means of revival and prevention as well. With that, it's a wrap on this show. Thanks very much for watching.